2018 in review. Brien Holden Vision Institute, Public Health. Our public health work is 20 years old this year. Professor Brien Holden launched ICEE in 1998. We've come a long way over the last 2 decades, and 2018's outcomes highlight some of the strategic themes we set out with at inception in 1998. We believe sight is a fundamental right for all humans. Our passion for science and innovation is driven by the pursuit of knowledge and compassion for all humanity. Our global strategies are influenced by local and cultural understanding and the core principle of sustainability. We are actively pursuing vision for everyone, everywhere. The need. The global need for vision correction has created disability and a poverty-induced health crisis worldwide. More than 1.22 billion people are unnecessarily blind or vision impaired simply because they don't have access to an eye examination and a pair of glasses. Our global programs stretch across the 3 main regions of the world, which have the highest uncorrected vision impairment and blindness prevalence rates. These are Sub-Saharan Africa, Southeast Asia, North Africa, and Middle East. The solution. Our mission is to develop sustainable vision care solutions globally to eliminate uncorrected vision impairment and avoidable blindness, thereby reducing global poverty and suffering. 89% of uncorrected vision impaired people live in low to middle income countries, which induces great economic loss. Our response: creating access to services. We work collaboratively to create sustainable eye care systems to increase access to affordable and locally delivered services. Both school and community outreach screenings are an essential component of our programs. Establishing eye clinics and strengthening existing eye health services are also a big part of our global work. Developing a global workforce. We educate across the spectrum from eye screener to optometrist, as we believe in creating confident eye health professionals at every level. In Australia, in collaboration with our partners, we train primary health carers, Aboriginal health workers, nurses, general practitioners to use retinal cameras to greatly increase access to detection and appropriate care of eye disease. Globally, there is a deficit of eye care practitioners worldwide needed to access vision and eye health and prescribe spectacles. We are addressing this need with our global optometry development program. In Vietnam and Uganda, we are close to graduating the first locally trained optometrists for their countries. Focusing on child eye health. We believe focused child eye health programs, when integrated into existing health and school services, can have the biggest impact on children's futures. Myopia can start at an early age, and this disease brings with it the likelihood of lifelong eye care. Through our Child Eye Health Global Initiative, our Children's Vision Campaign, we are accelerating and expanding access to eye health services to more children in more locations to screen 50 million children by 2020. Our Children's Vision is leading a call to action to come together to ensure that effective, sustainable eye health initiatives for children and adolescents are part of appropriate health programs and are integrated into regional, national, and global education and health policy. Driving gender equity. Gender equity is a central strategy of our global programs, and we support gender-based innovations in a wide range of programs and locations. Pakistan has a traditional and conservative society where women experience restrictions to accessing health services. Our Enterprise for Sight project addresses the challenge of huge unmet needs for eye care services at community level through a social enterprise approach. Influencing policy change. Policy change is enabled by consistent advocacy efforts and long-term consultation with governments and other key stakeholders. Due to our ongoing advocacy, this year has seen optometry emerge as a new profession in Uganda, ratified and supported by the government for regulation within the public sector. Evaluation and research. These measures help us quantify the nature and extent of vision impairment, barriers to service uptake, and the findings feed directly into our program design. Our global work this year has been greatly invested in both evaluation and research. In South Africa, a work productivity study produced findings showing an overall increase of 36.5% in vision-related quality of life scores after glasses were given to those who previously had uncorrected near vision impairment. In Pakistan, a social impact assessment highlighted the strength of partnerships, and our programs are playing an instrumental role in increasing eye health coverage across the country. We take the findings and scale up our health promotion initiatives, conduct more training, and develop mobile optometry clinics. A social impact framework modelled on Pakistan is now being integrated across our global programs.
The past 20 years have seen a period of immense growth by the Foundation. In partnership and collaboration with many, we have been able to achieve significant outcomes for beneficiaries, but importantly also have had lasting impact that will be seen for generations to come. This year, we have continued with a comprehensive approach to our work. The development of tertiary educated optometrists will have a lasting impact in their countries. This year, an additional 380 have graduated, bringing the total to 939. Gender equity remains a critical cross-cutting issue for us. Our global program figures for 2018 highlight we reached gender parity across services we delivered and the education and training programs we provided. Our Children's Vision campaign is one of our key global advocacy strategies. This year, we increased the membership to 80 partners, and together they've screened 9 million children. Since 1998, the Brien Holden Vision Institute has delivered eye care services to over 10 million people in 60 countries, dispensed more than 2.8 million pairs of glasses, and established over 400 vision centres or sites for eye care worldwide. We have also trained over 160,000 personnel around the world. None of this would be possible without the generous support of donors and funders, our fantastic partners, and our passionate, committed, and hard-working staff. Thank you to each and every one of you. The last 20 years' work and the outcomes and impact of our work would not have been possible without the foresight, ambition, compassion, and drive of our founder, Brien Holden. We miss him, but are proud and dedicated to continue and build on his legacy of vision for everyone, everywhere.